I don't know if I'm in the right place at the right time, because I don't know what you're talking about, basically. Like as far as your bus passes and um, other things that have been said. So
Your daughter's at the regional center, correct?
yes.
Okay. She's out at Pueblo Regional Center.
So is this where I need to be?
Yes, ma'am.
Okay.
Yeah. So this may not affect your daughter, what we're talking about regarding bus passes and stuff, but as of March 1st, Colorado Blue Sky employees, the ones that have decided to come over and the ones that we've vetted in will become TRE employees starting March 1st. So Colorado Blue Sky, they are going to be a provider agency only. Those that are remaining. TRE will take over the case management agency side of things. I'm sure you have a designated case manager. I saw those individuals flagged that had regional center placement. I don't believe those case managers will all be coming over, correct? If I remember correctly. Yeah. So you may not have really just the resource or CBE to the resource exchange right now. So that may be your only change right now. Yeah. As soon as we get caseloads figured out and those case managers who have not come to TRE, we will, like I said, either send you mail correspondence letting you know who your case manager is, and or the sign-up sheet, we will email you that information. However you want to be communicated, or whatever mode of communication you prefer, we'll make sure that happens. Now, there's someone. Oh, I apologize. Now, going back to what I was discussing, for those of you online, sorry, we temporarily lost you. Going back to case management redesign, during this time too, we also have what's called the PHE unwind, or the public health epidemic was lifted. You'll see that the County Department of Human Services has probably started asking you all for financial documents, asking you to sign maybe some redetermination paperwork, maybe some life insurance documents. During the PHE, or the public health epidemic, the state of Colorado decided to waive that process and what they called force pass everyone, so that nobody's long-term care services and or Medicaid would be disrupted. Well, since the PHE is lifted, they now have to go back and ask you all for that documentation. What we're seeing is that it's causing a lot of confusion for members and families. And they're like, we've never had to do this before. Why do we have to turn in this documentation? Well, you have to, because if the Department of Human Services does not receive what they request, it will call what is called a break in service. What that means is you won't be able to get your prescriptions, your providers who provide care won't get paid, we won't get paid, Colorado Blue Sky won't get paid. It causes like a domino effect, which that process has caused a lot of destabilization here in Colorado. Along with that, we have a new database system. It's called the new Care and Case Management System. that is not functioning as designed. They fix one thing and two things break, or they fix one problem and then five more things break. So we're currently, the case management agencies are having to work through those issues in conjunction with the PHE unwind, trying to figure out why there's breaks in services with the case management redesign. And so it is causing the perfect storm in the state of Colorado. Our CEO, Colleen Head Bachelor, along with some of the CEOs of the big Denver metro boards, we are also part of a group called Alliance. They are advocates with some of our provider agencies, have discussed these issues with the Joint Budget Committee and the Colorado Department of Healthcare Policy and Financing to let them know that this is really destabilizing services and supports for members and their families. We don't have any resolution yet, but their ears are perked up and they have agreed to meet with all the CEOs and Alliance to really figure out how to restabilize our long-term care services and supports. I know that's been a huge concern for a lot of members and families going through this process, and it becomes quite worrisome and scary for you all. So I wanted to let you all know we're working on it. And as soon as we get information, we will of course share that with you all. Yes, Nikki.
I wonder if you could talk to how the two different computer systems will be talking to each other to help streamline the system.
Yes, ma'am. That was next on my agenda. Yeah. So when I talked about the new care and case management system, or the database system that we're working with now, the goal starting Monday was the county's department database, which is called CBMS, is now supposed to talk to our database system, which is called the CCM, or the bridge, so that we don't have to send documents back and forth to each other. Oh, well, we need the LOC from the case management agency. Well, we need all of this from the Department of Human Services. Those databases are supposed to talk right now. We've seen that for the members who have what's called a March 1st start date, those services are being end dated 2/29 automatically. We have not seen the opening of the 3/1 start date, and I know that's confusing for you all, but possibly Cherie can explain it better than I can.
No, she's on the right track. The system is going through changes right now. So essentially, right now in the both systems, they read based off of what waiver you are on or the member is on. And so whether it's the SLS or DD waiver, it reads per the waiver. The system is going to go to one single code so that we're not having to update codes as people change waivers or things like that. So it will go to one single code. And then as your annual assessments are redone, instead of us having to fax over or email over something to DHS to let them know, like, hey, this person still is functionally eligible, they're qualifying to continue to receive their services. Once we do everything we need to do on our end in our system, it will upload into DHS's system. It's supposed to take overnight. We haven't quite seen all of that happen yet because they're still working on some of the pieces to the puzzle. But it's supposed to happen overnight, and then we'll get the same thing back to us saying, okay, we've updated the system, the DHS system. And then our system is also supposed to read that as well. So that's going to cut out a lot of the stuff that we're seeing happening right now as far as like breaks, because we're waiting for documentation to be worked or whatever the case may be. Maybe it was sent a little later than it needed to be, and so it's just sitting there right now. But the goal for this was to just get rid of that process altogether and let the systems read each other and work together. And so we're very hopeful that that's going to help with a lot of the concerns that we're seeing right now with breaks and eligibility. Oh yes, it started this last Monday, so 2/19 moving forward. If there was an assessment that was completed before that, we still have to do our old process with sending over documentation and then waiting on DHS to update things in their system. But anything starting February 19th moving forward should be in this new process that's happening. Any questions about that at all?
I think I've covered all my agenda topics already. That was a quick town hall, but I really do want to answer any questions you all may have. Any lingering questions, things that maybe we've not thought about? Because it's moving fast and furious, and I just want to make sure that we address all your concerns and questions. Okay. Yeah.
One of the things, Nancy, you didn't talk about was hours of operation. Because I
Oh.
think that's different than what they're used to now with the CBE.
Yeah. TRE, our hours of operation are 7:30 a.m. to 5 p.m. Monday through Thursday. And on Fridays, we're open 7:30 a.m. to 11:30 a.m. Yeah, Monday through Thursday, 7:30 a.m. to 5 p.m. And on Fridays, 7:30 a.m. to 11:30 a.m. We also have an after hours telephone, but those are for true emergencies and really to report any critical incidents. But we man that after hours and on weekends and holidays.
We do have one question that just came in the chat box. Says, I'm sorry I stepped out for a minute and may have missed it. When will we be notified who our case manager will be with TRE?
Prior to March 1st. I'm desperately working through that right now. It's a lot of juggling those vacancies, and I have to make sure that it's a process, because I can't have every one case manager take, for example, all March 1st start dates. They would be set up to fail if I did that. So I have to do it very strategically.
If there will be any bearing on the agencies. Currently, my family member is working with Spectrum. Does that change at all, or is that not affected?
It's not affected at all. Yeah.
Thank you.
Your services will continue as they are right now. And then once you have your annual, I'm not sure what terminology you all use here. We call it the annual or the continued stay review or CSR. That's when you have your annual meeting with your coordinator to talk about what's working, what's not working, what services you want, how many hours, frequency, scope, duration. Those will continue as they are. And then again, when you have, it's time for the annual 6-month review, or when we conduct our monitorings, you can, if you have any other needed concerns that need addressed, that's when you let us know. You can call us anytime too. So you don't have to wait for those specific timelines, but nothing will change.
The only thing that would be affected by your agency is if you lost eligibility. And as Nancy said, then everyone stops getting paid, then they might try to put services on hold. And so it's really important to watch the mail for that redetermination packet, because a lot of things are being missed right now with that getting turned in.
Nancy, I have a question. And this might be for Blue Sky and you, but if somebody was just trying to get on one of the waivers and they've submitted their intake forms to Colorado Blue Skies, will that be transferring to TRE or would they need to do your guys' intake form?
They don't need to do our intake form. We're actually meeting with their intake staff next week, this week. They're all blurring together because we're coming up with a game plan to make sure that nobody falls through the cracks. Our goal right now too is that starting actually next Monday, we just have to talk to our staff that will start stepping up and doing a lot of those pieces because right now it's really hard for families to know, who do I call, CBE or do I call TRE? And so we want to get ahead of that and make sure that those members that were going through intake, that they're not lost in the shuffle. Yep.
Okay. I have a mom that just texted me that question. I was like, I have no idea. Let me ask that. I'm in the right place. And then with the CES waiver, if you have a kiddo on the CES waiver, will you talk about the case management side of that? Because you already have it kind of figured out and that most likely their case manager is going to change. So can you talk about that a little bit?
Yes, thank you for reminding me, Terry. So Janine here, who is sitting on my right, she has worked with the CES waiver and the CHIRP waivers extensively at the Resource Exchange. She actually lives here in Pueblo, and so she will be one of our Pueblo case managers. And right now, what I'm doing is we are building her caseload. Easton, whom if your child is in CES, is one of the employees who have decided not to come to TRE, but she and Janine have already met and Janine is already taking on those caseloads.
And so if anyone's here that has a CES or CHIRP kiddo and was with Blue Sky, and if you want to come see me afterwards, please do. I would like to get your contact information because my goal in the next couple of months is to meet all the families. I'd like to meet them face to face or through virtual or however I can, whatever's convenient for you guys. But please let me know if you do have a CES CHIRP kiddo, come see me afterwards and I can get your information so that way we're staying on top of it on our end as well.
We have one more question from the online chat. What's the wait from staffing/eval meeting to the state approval? They said, I have a packet, but I don't know who to send it to.
So can that person take themselves off mute? I think I know what they're asking. So it sounds like a new intake. Going through.
That would be me again. I'm just very, very confused.
Okay, go ahead and ask your question.
So I have the packet and it's supposed to be returned, I guess, by March 1st, but I don't know, do I return it to Colorado Blue Sky and how can I make sure that I get it to you guys? And once you guys get it, I'm trying to avoid a lapse in services.
So is it a Medicaid packet or is it
It's for the CES.
okay, so it's a CES application.
It's a renewal,
Yep.
I
yep.
guess.
You can go ahead and get that to Colorado Blue Sky and then we'll get it to Janine because she's been coming into the office.
What's the start date? Just out of curiosity. Is it
Hold on, let me look. I don't know exactly what the start, 6/1/2023 is what's written on it.
Okay. Well,
Can I get your information, your contact information, like emailed to me somehow so I can contact you directly so that we can talk?
yeah. Yeah, okay. Kyle, if you can put Janine's email address and telephone number in the chat, we'd appreciate that.
Thank you guys so much.
You're welcome. Any other questions? Okay, if there are no more questions, then, yeah. And again, just a quick reminder, if you would like us to use an email address, please go to the back table and make sure you write your email address down for us. And also make sure you put your loved one's name, so that we know who we're working with. Is there anything else, Amy? Okay. All right, well, thank you for attending and I hope you have a great rest of your day.